Hi, I'm Ria David. I'm 50 years old and I am from Angeles City. Nandito ako ngayon sa CSA to treat my melasma na matagal ko ng problem ito. Since 9 years ago na to, galing na ako sa ibang clinic sa Manila. Marami na rin ako napuntahan na doctors. Pero, nandito pa rin yung problem ko. So now, nandito ako kay Doc sa CSA para to treat my melasma. Please click the subscribe button and click the notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic, the so-called melasma. And we have with us, Ma'am Ria. Welcome, Ma'am Ria.
Welcome po.
Hi, hello Doc.
Yeah.
Hello Doc.
Hello, kamusta?
Mabuti po.
Okay. So si Ma'am Ria, she has been our client for quite a while. And we started doing a treatment already on melasma. So before we discuss what was the treatment, let's get some history from
Yes, ma'am.
Ma'am
So,
Ria.
how young are you, ma'am, ngayon?
50 na po.
So, you had this pigments, kailan pa ito
Mga
nag-start?
8 years. Mahigit
8
na,
years,
oo,
oo.
mahigit 8 years na.
And then, meron pa tayong mga treatments na ginawa sa atin.
Meron yung laser,
The CO2 fractional.
laser CO2.
And then,
po ba?
kwento mo naman, ma'am, anong nangyari after the CO2 fractional laser?
First day nung nakita ko siya, medyo gusto ko rosy-rosy. After nun, biglang dumabas yung melasma ko.
Nag-darkening po
So,
siya.
nag-dark siya. Naging
okay.
panday style. Dalawang cheek
Both
ko.
cheeks. Yeah.
At pati dito, yung
Upper lip.
lip ko.
Yeah.
Nagkaroon siya ng dark spot.
Okay.
So, nagulat ako. Sabi ko, ba't naging ganon?
Naging ganon.
Yun na pala yun. Tawag pala doon is melasma na. So, naging malaking problem ko siya.
Well, actually, the definition of melasma, it's a chronic skin pigmentation disorder.
Yes.
It can be on and off. Okay? So, yung other term nila, they call it yung brown patches or mask of pregnancy. Originally from cloasma. So, among pregnant women, they start to notice mga pigments sa cheek area. So, we call that cloasma. And mas common ito talaga sa kababaihan among women. And actually, they were associating it with hormones, female hormones. Okay?
So, pag nag-pregnancy, doc, because of tumataas ang hormones natin, doon sila nag-inflict or nagpo-produce.
The hormone of pregnancy, I think it's the estriol, yung type of estrogen ng mga women. And then, di ba nananotice, ito, doktora, di ba, gave birth already, I too. So, may nananotice tayong mga darkening or pigmentation sa ating skin. So, pagka nag-persist yung ating pigmentation after giving birth, and then, nagkakaroon na tayo ng mga melasma. Okay, aside from the hormonal etiology, we can associate melasma also from UV or sun ray exposure. Yung palaging outdoors and then exposed to sun rays. So, mas nai-stimulate yung melanin pigment formation. Yun. Ngayon kay Ma'am Ria, so she was discussing with us before, hindi pa tayo kilala ni Ma'am Ria noon. So, she went to other clinics and then she underwent CO2 fractional laser. Anong reason po? Bakit tayo nagpa-CO2 fractional?
Sabi kasi nila, tinanong ko dahil open force nga ako. Sabi ko, Doc, concern ko, open force ako.
Yeah.
So yun, para mag-tighten daw.
So they did the...
Ginawa yung procedure na yun. After nun, doon ako nagkaroon ng melasma.
Yun.
So siguro dahil sa heat
the heat of the laser.
Laser.
Actually, the fractional CO2 laser, one thing that we also want to prevent is the so-called PIH or post-inflammatory hyperpigmentation.
Yes.
So, among Asians, phototype skin 4, 5,
4,
6,
5, 6, yeah.
mas prone tayo sa skin pigmentations.
Yes.
So, mas natitrigger yung formation ng melanin pigments. Nag-accumulate yan, nag-iipon yan sa, from melanocytes, pupunta sa keratinocytes. So, they just accumulate there, nagiging na sila. Very prominent patches, dark brown patches, cheek
Usually
area.
on the cheek area.
Yes. The others naman, meron yung centrofacial type of melasma sa cheeks, tas may forehead, tas sa nose, meron din, tsaka upper lip. Yung iba naman yung jawline area or mandibular area, nagkakaroon din ng melasma or mga brown patches nga. So, yun. Others naman, yung may mga intake ng mga pills, hormonal pills, contraceptives prone din sila. May tanong din nga even men, do they get this?
Of course.
Yes. There's a certain percentage, small percentage, that men also get melasma. So, actually, I already had clients, male clients that I treated yung kanilang melasma. So, it's not only among women, but also men. But it's more common talaga among women. Yan. So, yung concern ni ma'am na melasma condition, so, she came to us, Ma'am Rhea, weeks. Nag-start na yata tayo mga 2 months ago.
Ganun.
Yun, mga 2 months ago. And then, we did treatment na po. Nag-start na kami actually treating her melasma. We had 3 sessions of the Lucid Carbon Laser Pill. So, can you share with us po yung findings, yung outcome ng ating 3 sessions pa lang?
Naka 3 session na ako, so malaking pagbabago na siya. Nagulat ako na ganito. Eto na ngayon. Kahit pa paano.
May lightening po tayo
May lightening
sa mga
na siya.
treatment. So, happy ka ma'am dun sa treatment?
Very, very happy.
Yeah, kasi na-notice kong, I think it was, more profound cheek area. I think we can show a picture of that, yung dati pa. Tapos, mas malaki yung pigment. Tsaka, mas noticeable talaga dati. Ngayon, na-minimize na.
Medyo nag-light na.
Yeah.
Konti.
Actually, we also had a video on melasma. We did an episode on that. We had a profound discussion on melasma. And the procedure we did was the Lucid Q-switch and diag laser for our melasma. Actually, we need sessions of that one. It's not just done in one treatment. Melasma is gone already. Actually, melasma did not happen over time. Diba? Medyo ilang years na po.
Accumulated for 8 years.
Yun. That's why the treatment also is being done in sessions.
Several sessions. It's never a magic doc, diba? So,
Exactly.
Several sessions
So,
you need for the treatment of melasma.
So, merong number of sessions po yan. Right now po kasi, we're discussing melasma again kasi we want to do or we want to present to you another kind of treatment for melasma. Now, we can combine with our lasers. Take note, the lasers actually, they have this type of certain temperature also. So, somehow po, nadidehydrate yung skin. So, we need to also restore the hydration. Because very hydrated skin, pigments cannot stay. So, we wanted to show ano pa ba yung treatment na pwede natin i-combine for Ma'am Rhea para talagang ma-achieve din niya yung glowing skin, yung talagang blemish-free skin. So, ano kaya ang treatment na ating gagawin? Ating ipakita sa pagbabalik ng CSA Medical Aesthetics. We're back mga ka-CSA, so we are at the part of showing you procedures that we will do for the treatment of melasma. So Ma'am Rhea did already 3 sessions of Carbon Lucid Laser Pill. So we will be doing a 4th session right now in combination with another type of a treatment. So as you have seen in other episodes, we use this Lucid Q-switch and diag laser, and we'll be doing a peeling of the carbon gel that we have applied. So as with any other treatment, you start with cleansing the face. Right, Doktora?
Yes po.
So, kailangan mo natin alisin yung mga sunblock na na-apply or makeup or any powder. Ayan. So, we have to clean the skin area. And then after that, we did apply the topical carbon lotion or carbon gel. So, starting with the first treatment, first pass, we call this the quasi-long pass. So, we'll just be targeting the full face with this laser treatment. So, ano lang po siya, parang tiny pricks. As much as possible, we want the temperature to be very controlled.
It's regulated.
Yes. Extremes of heat kasi can also aggravate pigments. Okay? So, it should be in the right temperature lang. Kaya yung mga ibang clients ko with melasma already, I don't recommend yung mga radio frequency, yung may mga sobrang thermal heat. Kasi nasa ano yun 50 to 70 degrees yung temperature. So, we wanted to avoid yung sobrang init.
Sobrang init po.
Si Ma'am Rhea, mahilig ka rin bang magluto?
Yes.
Ayan, pag lagi kasi araw-araw nakaharap ka sa kalan, yung mainit, so yung mga may melasma, mas nakaka-trigger din or mas
Yes.
nag-aggravate yung pigmentation
Because
nila.
of the heat po na overproduction of the melanin din. No?
Yeah.
Huwag na ako magluto. Hindi ko na pagluluto yung anak ko.
So, after the first pass, the quasi-long, we'll proceed to the 1064. So, this one has a popping sound, medyo maingay lang. Ayan. Alam na ni Ma'am Rhea to. Ayan, sound lang. Ayan. So, with this second pass, you can see already the carbon gel is disappearing. Ayan. Parang ano na. Ito yung peeling effect, carbon peel effect. Okay. So, we did also an episode on the carbon system. This is a different type of carbon treatment. Now, this one needs this Q-switch laser. So, the other one we did was a different type of a V-carbon system. And by the way pala, kasi Ma'am Rhea shared with us kanina that she used some strong astringents in the past. So, yung mga in-apply niyang matatapang na astringents, yung experience niya, mas nag-trigger yung pigmentation. So, on top of the CO2 fractional laser, nagkaroon pa ng gamit ng ating mga, alam mo na, yung mga astringent na yan, kasi we
They're
wanted
available outside the supermarket
Outside,
and
yes.
also the drugstores, gano'n. Kaya, readily available. That's why yun. Sinubukan mo ma'am no, mga matatapang na aspirin na yun.
Oh, may number 1, 2, 3 pa yun eh. Nagsinubukan ko talaga siya.
And then it gives you a rosy cheek.
Oh, sa una, rosy cheek.
sa una,
Sa
yeah.
una lang yun.
Sa
After
una.
nun, ayan na.
Doon na nag-boom ang pigments din.
Ayan na.
Kasi doktora, yung, di ba gusto kasi, dati kasi, mga commercial, pinapakita, rosy white skin.
Yes.
Using those strong astringents. Pero kasi once namula yung skin, ang kasunod ng redness, pigmentation.
Accumulation of the pigments. Yun yung
Kasi when there's redness or erythema, that's a sign of inflammatory condition already. So, na-trigger na lang yung formation. Defense mechanism kasi ng skin, pag may inflammation, yung brown pigment is also a defense system of our skin. Kaya di ba pagka we go to the beach, nagpapaaraw tayo,
Yes.
pwede kasing yung skin natin mas nagda-darkening. Kasi it's like a protective layer also for against UV rays. So, parang sa mga Asian skin na brown skin, we have a protective pigment against the strong UV rays.
That's why sunblock, wearing sunblock is also one of the prevention ng ano natin, di ba?
Exactly. Kaya kailangan, yung mga may melasma, they should always put on sun protection. Ideally, SPF 50.
It's only
Yan.
the FDA approved na pinaka-highest na SPF 50, no? We have it here, several sunblock here in CSA. If you want to avail, no, pwede din online.
Yes po. And also, when you're doing treatment kasi na ganito, laser, kasi we wanted to remove the pigments. Ang laser kasi tutulong dun sa mga bloke ng pigments para ma-disintegrate sila. So once you
Mabababa.
disintegrate, yeah, so you're clearing the skin of the pigments. However, your skin will also need hydration. So, yun yung next nating treatment na gagawin kay ma'am. Kasi this is laser, take note, our skin will need like around 60 to 70% moisture. So, kailangan nyo rin samahan nito ng hydration treatment. Hindi lang itong laser, but you have to combine with your rehydration treatment. So, take note talaga, you have to really consult your aesthetic doctor to also analyze your skin condition. So, dati si ma'am sabi niya, nagkaroon din daw siya ng melasma or pigment dito sa part ng upper lip area. So, we can also target that. Ayan. So, dahil nasa 1064, now I'll be proceeding yung PTP 1064. So, 3 passes tayo. Okay? So, what's the feeling, Ma'am Rhea?
Okay lang.
Wala namang sakit, no?
Walang
So,
sakit.
painless procedure kasi itong laser natin na Lucid. Carbon Lucid.
Wala siyang pain.
Well,
Wala pain na mararamdaman.
Yeah. Highly recommended ito for Asian skin. Kasi kung mapag-PIH tayo, yung mapag-pekas, mapag-pigment, yung sa CO2 fractional laser, well, it's okay. But as long as regulated din yung yung energy ng fractional laser. Kasi if you just wanted to do yung pore reduction, okay din si CO2 fractional laser, but we have to also control yung energy, tsaka yung depth na tina-target. Kaya pagka may mga lasers, importante talaga na ina-analyze natin ano lang yung right amount, right energy level that the skin could take. Otherwise kasi, magkakaroon lang ng side effect na mas magkakaroon ng mga pigment, masusunog, exactly. Kung mga pore reduction, there are also other lasers for minimizing our skin pores. So our next treatment will be the rehydration treatment. Okay, so I will be using my Belotera soap with hyaluronic component. So we wanted to restore the normal hydration status of our skin. So this is gonna be like a meso injection only. I'll be starting on the cheek area. Since dito yung focus ng ating melasma pigment. And actually, another thing we have to add also, meron ding vascular pigment si Ma'am Rhea. So aside from the brown or melanin, we also have to treat yung tinatawag na red pigment from the RBCs, yung heme pigment also. So this is now Belotera soap with our hyaluronic. Okay, it's just a tiny injection po. Like tiny prick lang. So normally we just inject it intradermally to create some tiny blebs only. Yeah. So on top of our hyaluronic dermal filler, we'll also be combining it with beauty boosters. We have our skin booster or beauty booster with components of like growth peptides, amino acids, vitamins, cytokines, and other natural growth peptides. So those are system peptides na kailangan din ng ating skin for rejuvenation, regeneration, repair, and also yung brightening or whitening effect. So the good thing with this type of treatment, you're placing already the nutrient and the substance within the dermis, where you have all those dermal cells or dermal components that will help in brightening our skin.
Yes.
So there's nothing wrong with yung skincare every day na you put on your moisturizer, your facial skincare, toner, cleansing your skin. Okay lang yon. You just continue with that. Although yung mga pinapahid nating mga topical creams, the thing is they just sit on top of the skin. So some of them are not really entering or penetrating inside. Hindi sila na-absorb totally ng ating skin. So we want to place now the product inside our skin para talagang mag-glass skin and also maging blemish-free skin.
Make it penetrating deeper po na.
Yes. So para hindi rin dull yung skin. Tapos yung parang the skin looks tired or looks so dry, looks so dehydrated. So we want to bring back yung luster, yung radiance, yung natural glow ng skin ni ma'am. Okay. So gagayahin namin yung skin ng daughter niya, si Jazz. Di ba, we did just Korean glass skin like 2 weeks ago, no ma'am? So na-notice mo rin yung skin niya?
Yes, ang ganda. Na-inject ko din ako sa mga
So, anong napansin niyo po sa skin niya nung nagawa na yon?
Every morning, napapansin ko yung glow ng skin. Kumikinang siya. Sabi ko, wow, ganda naman.
Without makeup yan, ma'am.
Oo, wala siyang makeup, pero yung glow ng skin niya nakikita ko. Lagi ko nga pinipisit yung pisngi niya. Sabi ko, gagayahin ko rin siya.
Ayan. So, we're proceeding to the right side. And this kind of treatment is okay for all skin types. So, you can do this skin regeneration, skin boosting, or beauty boosting treatment. And in terms of how many times you should do this, it's okay to do this 3 sessions, 4, 5, hanggang 6. Or you can do an interval of like every 2 weeks, every 4 weeks, once a month, or twice a month.
To achieve the rehydration
Yes,
process.
correct. So, depending also on the degree of the melasma problem. Yung iba kasi very severe, generalized yung melasma nila. So, they need more treatment. Lalo na yung matagal na talagang may melasma or it's been chronic. And then, very dry na rin yung skin. They will really need more sessions of this. Okay. So, like in one treatment, you can use 1 syringe of your Beloterosoft and focusing in the area where you have your melasma. Okay. So, after this hyaluronic, I will combine with my beauty boosters. Now, those beauty boosters, they contain vitamins, minerals, aminopeptides, growth peptides, cytokines. So, those are components of our natural tissue repair system. So, anti-aging na rin, anti-wrinkles, and aside from being anti-blemishes. Okay. So, this is an ideal treatment for those who wanted to really achieve that clear skin, bright skin, glowing skin, radiant skin, or yung tinatawag na glass skin. So, I'll proceed with my beauty booster. So, let's have it's like a meso injection lang ng ating beauty booster. So, I have here actually an Oriole. So, it has some vials there, and then inside those vials, we have already those natural components. May vitamins, may minerals, and aminopeptides or growth peptides, or yung mga cytokines. Still recall cytokines, Doctora? So, this is just, yeah, in biochemistry. So, these are just, again, meso injection po sa ating skin. So, when you say meso injection, parang multiple tiny injection into the dermis of our skin. So, this one will help in restoring the natural glow of our skin. So, kailangan din po na i-apply natin within or the inner layer of our skin. So, we'll apply na po. So, some patches of pigmentation dito rin sa mandibular region. Sorry, Mama. Is ganda talaga to. Then, we'll be using another CC on the other side. And then, also for the forehead region. Okay? So, I'll be finishing this right side here. Actually, this is also good for those with acne scars or pox scars or any type of scars on the face. So, we have done the injections of our hyaluronic and beauty boosters. So, I did combination of the Beloterosoft with the Mesohyal and our Oriole skin boosters. So, we did like multiple injections all over the face. We wanted to highlight areas of the face where you can radiate the skin or give that glowing effect. Okay, so it was injected intradermally. We made some bleb formation there. And then after that, we used our cryotherapy machine together with our hyaluronic serum. So that is also to infuse more hyaluronic into the skin, so more hydration. And then, the final one, will be using our Aqua Shine face mask. And we'll leave that on for like 10 minutes. So, we will continue when CSA returns. And we're back, mga ka-CSA. So, we are now the part of showing the result to Ma'am Rhea. And here's our mirror, Ma'am. Ayan na po.
Wow.
Okay lang po.
Maganda na siya.
Opo.
Okay siya, Doc.
Marami pa pong mga puncture marks kasi we did multiple injections. These are meso injections all over the face.
Yes.
So immediately after the treatment, it's normal to expect some of the blebs or meron parang medyo nakakonting umbok-umbok po. Those were the ones that were injected, yung mga beauty boosters natin.
Yes.
So medyo makikita muna natin yung mga tiny marks na yan. But then in a little while, gradually nagre-resolve. So nagpa-flat yung parang mga bumps. And then maya yung mga tiny inject na yan, nagki-clear.
Yeah, it
And
will
then,
absorb kasi doon sa mga skin natin, no?
Yes.
Yeah, nag-clear out siya.
and then titignan natin like after 7 days, ano ba yung outcome?
Opo. I'm
Kasi
excited.
the first week yan nagkakaroon na ng effect sa skin, yung mga in-inject nating mga beauty boosters, vitamins, minerals, peptides. So they're beginning to work already in the tissue system. It's like a repair system, regeneration, rejuvenation system. Parang ginigising lang natin yung mga wonderful peptides ng skin na nagdi-deliver ng radiance, ng glow. Ayun.
Nagising yung natutulog na yung skin ko.
Yeah, that's exactly that. Yeah, correct. You're just awakening all those natural tissue system to rejuvenate your skin. So, I think we'll be showing yung photo ni ma'am, yung post 7 days, post 14 days. And then this kind of skin booster injection, you can repeat this every 2 weeks to 4 weeks.
Ayun.
Or the others nga kung nagmamadali, you can again do meso injection after a week.
After 7 days.
Yes. So parang lalo mong binuboost yung una mong ini-inject. So pag-usapan naman natin, Doktora and Ma'am Rhea, yung ginawa nating carbon lucid laser. Kasi yun, remarkable din yung result, yung treatment ng melasma natin. Dahil ayaw na natin kasi kay Ma'am yung matatapang or mababagsik na mga lasers. We wanted something that's gentle, na nakakakita ka lang ng result, na nag-clear yung skin. Kasi napansin ko talaga, yung dati, talagang well-demarcated yung melasma niya.
On the cheek area daw.
Yeah. So ngayon, naka 4 sessions na tayo ng Lucid carbon laser. So medyo nag-reduce, nag-lighten pa yung mga pigmentations niya.
Very good news.
Right, ma'am? Di ba?
Oo, tama daw.
Yun.
Nag-light na siya ng konti.
Oh, pero kung titingnan ko siya, wala siyang walang makeup, walang whatsoever, bare na bare talaga nating pinapakita. Pero somehow parang medyo may glow na, no?
Meron na po.
Yan.
Kumikintab na
Kumikintab
yung
na siya.
face.
So these are treatments for melasma that we could say they really work. Okay? So, regarding kay ma'am naman, na-share niya kasi 'di ba, you said or you told us kasi before gusto mong gayahin yung may mga rosy white
cheeks,
skin, rosy cheeks. Tapos ano yung mga ginamit mo noon?
Nag-astringent.
Ayun.
Matatapang na astringent because these are usually alcohol-based.
Correct. Would you wanna share something about that? Or say something na dapat medyo iwasan yung ganun?
Oo. Iwasan nyo na lang yung matatapang na astringent.
Yes.
Kasi,
masyadong malakas.
Oo,
strong.
malakas yun. Sa una, akala nyo ang ganda.
namumula-mula.
Kasi namumula-mula.
Yes.
So, akala nyo ang ganda ng skin. Pero after nun, pag na-expose kayo sa araw, ayun na yung magsisimula ng kalbaryo ng face nyo. Darating na yung mga melasma. So, mahirap gamutin. Pero, to the rescue, nandito si Doc.
Pero,
Subukan nyo.
syempre naman po, sana huwag tayong magkaroon ng mga gano'n na nire-repair Kasi yung mga, they use a lot of those astringents. Meron pa nga ako naging patient na yung matatapang, tapos apply. Gusto niya kasi mamula-mula yung skin niya. Pero, yun, lagi naman siyang naaarawan. And then, nag-iwan talaga ng malaking pigmentation sa face niya. Naging mapa. Oo. So, this one is a combination type of treatment. Of course, meron pa rin yung mga daily skincare regimen, yung mga ina-apply mo. What's more important will be the mild skincare. And we would recommend yung mga moisturizers also para tuloy-tuloy yung hydration ng skin. Kasi we did laser, so we wanted to combine with something to rehydrate and repair the skin. Okay? So, kung healthy and well-hydrated ang skin, pigments cannot stay. It will also clear up that one.
Well, of course, yung mga nasabi ni ma'am regarding the astringents, yung mga nakikita sa supermarkets, they're all good because they're usually FDA approved. However, yung paggamit lang natin.
Correct.
So, kailangan ay aesthetic physician or certified po yung mga doctors na mag-a-advise po sa inyo. Kasi kanya-kanyang doc, diba? Skin texture, skin type, Yan.
Oo.
Baka hindi ito good for your skin type.
Ayan
So,
po.
go to CSA, Medical Aesthetics.
Right. So if you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, and also our Instagram, CSA Medical Aesthetics. Ang aming clinic po ay matatagpuan dito sa The Infinity Shops, Francisco G. Nepomuceno Avenue, Pulong Marugol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Yung mga iba naming topics, don't fail to watch yung mga ibang episodes dun sa YouTube channel, Contessa Salvador. Ayan. Maraming salamat po. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.